Do you feel like you're constantly stressed and anxious? Does your mind get hooked on endlessly analyzing everything that could go wrong? In this video, we will look at how techniques like eye movement desensitization and reprocessing (EMDR) and cognitive behavioral therapy (CBT) can help process the stress and stressful memories and reframe unhelpful thought patterns that fuel anxiety. Then I'm going to be providing some highly effective tools and techniques for better managing stress. My goal is to give you evidence-based techniques and some actionable strategies that empower you to feel less anxious day to day. EMDR is a therapy approach that is being used to treat anxiety. It involves making lateral eye movements while recalling anxiety-provoking memories or situations. This bilateral stimulation is believed to help process the traumatic memories that may be contributing to anxiety. In EMDR, the client focuses on the upsetting memory, negative thoughts, emotions, and body sensations while engaging in left-right eye movements by following the therapist's finger or using taps or audio tones. This dual attention taps into the brain's natural information processing systems. Over time, distressing memories seem less vivid and trigger less anxiety. The repetitive left-right eye movements used in EMDR appear to activate neural networks that reduce arousal in the brain's threat response system. However, the alternating left-right stimulation of EMDR seems to decrease alertness and vigilance against perceived threats. Moving our eyes rhythmically side to side triggers a type of orienting response that lowers defensive reactions and creates a brief state of calmness. EMDR can help identify memories or beliefs that feed into current anxiety. By reprocessing those traumatic events, their negative intensity diminishes. Fear and triggers no longer cause the same panic response. This allows traumatic memories or current triggers to be processed without provoking as much panic and hypervigilance. The bilateral eye movements of EMDR relax the body and mind, keeping the individual from being overwhelmed as they confront upsetting thoughts, events, or situations. It is important to note that EMDR is a specialized technique that should only be administered by a qualified mental health professional. Dr. Andrew Huberman also talks about EMDR on his podcast that eye movements side to side reduces the activation of the threat reflex. We feel less alert or calmer when we move our eyes side to side. Then he argues that EMDR only helps with the extinction of the experience of the physiological response to the old experience. But it seems that after processing the traumatic event, we should relearn a new narrative and attach a reward. Now this attaching new narratives brings us to discuss cognitive behavioral therapy. By subscribing to our channel, you support our mission in delivering values at absolutely no cost. Cognitive restructuring is a core CBT technique used to counter anxious thoughts. It involves the following steps. First step is identifying the automatic anxious thoughts associated with a situation. For example, this presentation is going to be a disaster. I'm going to mess up and be humiliated. The second step is evaluating and challenging the reality of those anxious thoughts. Is there real evidence this will be a disaster? Have I done presentations successfully before? Third step is developing a rational response. While I feel nervous, I'm well prepared and my past presentations went fine. I can handle this. Let go of the anxious thoughts and intentionally replace them with a more balanced perspective. Now what if when automatic negative thoughts are being evaluated, there are times when the thought is found to reflect a real issue? If the problematic thought is based in reality after objective assessment, the next step would be problem solving. Rather than dismissing the thought or fighting it as irrational, the therapist and client would collaboratively develop strategies to effectively address the real-life concern being identified. Problem-solving skills would be applied to tackle the external situation producing the distressing thought, rather than just changing internal cognition. CBT utilizes cognitive restructuring to shift unhelpful thinking patterns as well as active problem solving when warranted. If a realistic thought signals an issue requiring action, CBT enables facing the problem to resolve it by taking actions. In this way, evaluating thoughts in CBT can lead to both internal and external solutions, depending on what is most appropriate. Here's an example of using problem solving in CBT when an evaluated thought reflects an actual problem. The client has the automatic thought, I'm going to lose my job if I keep struggling with being late. The therapist would help analyze these thoughts objectively. If the thought is accurate, then CBT would move into active problem solving. The therapist and client might brainstorm and implement strategies like adjusting a sleep schedule to allow more morning preparation time, or setting multiple alarms for gradual waking up, or asking about fixed schedules or work from home options, and also identifying and resolving any psychological blocks about work. With practice, cognitive restructuring builds the skill of catching our anxious thinking, analyzing it objectively, and shifting to a more realistic viewpoint that allows us to manage the situation in a less anxious way. It moves us away from catastrophizing and enhances self-efficacy. When it comes to anxiety, cognitive behavioral therapy views it as stemming from distorted, irrational beliefs about perceived threats and one's ability to cope with them. When we feel anxious, we are overestimating the actual danger or threat in a situation while underestimating our real capacity to handle and deal with whatever arises. Anxiety makes us think about the worst-case scenario in that we're powerless, but CBT challenges this unhelpful perspective. The reality is we often have the tools and inner resources to manage challenges that trigger anxiety, but anxious thinking exaggerates the threat and diminishes our self-efficacy. CBT helps identify and reframe these cognitive distortions. We can assess risks and threats more realistically, and we recognize our ability to tap into our skills, wisdom, support systems, and past experiences to confront difficulties. CBT empowers us to shift from an anxious mindset of, I can't handle this, to, I can take positive action to manage this situation. In this way, CBT moves us from self-doubt to self-trust. Now, I would like to invite you to look at the bigger picture in your life. It's understandable to feel anxious about uncertainties or challenges that arise, but in these moments, I encourage you to look at the bigger picture in your life. Consider the greater context beyond temporary struggles. What are your core values? How do you want to grow and contribute to life? Who is the best version of yourself you strive to become? What version of yourself are you aiming to embody? Define the qualities of how you wish to think, feel, and act during stress. Paint a picture of your best, most grounded self. Keeping this broader, uplifting perspective in mind can be very powerful. Rather than reacting fearfully to life's challenges, see them as opportunities to practice embodying your highest self. This vision of your potential gives you direction. Let it guide you to respond from your highest intentions, not reactive habits. The more clearly you envision your empowered self in the face of adversity, the more you can align your thoughts, emotions, and behaviors with that version of you. Stress management requires knowing yourself deeply. Keep refining your vision of your highest character. Approach difficulties from a place of building wisdom, compassion, integrity. You can shift your perspective that managing anxiety is not about resisting life's ups and downs. It's about developing inner strength to meet adversities in ways that align with your highest principles. See the bigger picture of who you wish to be. Let your values guide you to face challenges with courage and grace. At first, this vision of your highest character or a better version of you may seem unfamiliar, especially in moments of stress when old habits kick in. Responding with wisdom, strength, and compassion likely doesn't feel like your natural state yet. But keep in mind, this ideal you is not out of reach. With consistent practice through visualization, self-talk, and intentional behaviors, you can become familiar with this version of you. If you want to go deeper into creating your vision and becoming the better version of yourself, make sure to check out my Best Self playlist after this video. Let me know if you have any questions in the comment. Thanks for watching, everybody, and I'll see you in the next video.